teething can be a common thing that we hear about, whether we're first starting to work with families or, say it's a regression where, maybe people have been sleeping well or not. And then the teething factor comes in. And of course, teething happens a lot with our children and with our babies, and over the course of, many months, really years. So it's important to kind of talk about teething when it comes to sleep, because there are some myths in terms of how much it impacts sleep. So in your experience, have you kind of come across that with teething and just the kind of misconception sometimes too?
For sure. I feel like poor teething gets blamed for poor sleep. Teething often, is the first thing that comes to our mind. And of course, when our kids are in pain, it's something we do want to consider, because it doesn't feel good for us as parents if they are in pain that we're like, no, it's not that, you're fine. So we always want to look at that. But typically teething, it should only last a couple days. Really, when those gums, like when they're about to pop through, that's where we kind of see this pain kind of happening. And obviously at your doctor's discretion, but you can use like medication or things like that to help manage the pain. But often if we go into their room and they are in pain, when we pick them up, they don't calm down. So if our kids are being picked up and they're calming immediately, then it could be a good indication that, it might not be teething pain that's actually bothering them and they're actually waking for another reason, maybe out of habit or looking for comfort or things like that. We're not saying don't comfort your kids ever. We love our kids. We'll make those concessions when they're not feeling quite themselves. But if night after night this is kind of happening, then we'll want to take a deeper dive into, is it really pain or is something else motivating them to wake, or do they think they need something in order to get back to sleep? So I would say that's kind of the common area. I mean, teething, I feel like goes on forever. Even my 2-year-old, there is truly sleep disruptions. The odd time, from teeth really breaking through, it can be painful for them. But in my experience, it's quite short-lived. Maybe one night of kind of being off and then kind of continuing back to basics, back to normal the next night.
Right. I find the regressions really turn into regressions due to teething because of the changes we make, right?
Exactly.
We go in because it's teething or because it's pain. And maybe we administer pain meds or give some comfort as a loving parent would. But then sometimes if it lingers multiple nights, then that night, like 3, 4, 5, it's not necessarily teething pain anymore. It's now just kind of become the habit of, you guys come in here. I like this. Yes, I will take that medication. Totally. Right, which then, like you said, kind of gets blamed for bad sleep, where it's not necessarily the teething per se.
Exactly. And we don't want to over-medicate our kids if they don't actually need that. It's kind of hard to, I feel like that's one of the hardest things to suss out, habit or hunger, and then teething or, motivation. And it's kind of, we want to take a big step back and take a quick look at, is something going on? Are our kids sick even? Because, with illness comes disruptions too. And of course, we're going to make concessions and support them and do all those things. But often what our kids need when they're not feeling well is just sleep. So how do we support them yet balance that kind of need for sleep to allow them to kind of that rest to get better? And it's what you said, like 3 days typically kind of forms a habit. So, we want to look at our support and love on them and do all those things, but watch kind of how long we're doing that for. And then in their mind, is it better than sleeping kind of independently? Because who doesn't love mom and dad and that kind of snuggle and, all that engagement. So.
Yeah. And the nice thing is, for good sleepers, I do find a lot of them sleep through teething. Where, you'll see it during the day, they're drooling, they're gnawing, you can tell they're teething, but then, they sleep fine, they go to bed fine, sleep through the night, and wake up and they got a tooth popping through. So I found that with my kids and with a lot of good sleepers is that, a lot of times the teething isn't actually as bad as we think it's going to be, which is great.
Totally. Yeah, I agree. Even illness, our kids might need us, but typically with good sleepers, I find for my kids, they just want to go back to sleep. My son now asks to go back to sleep. I'm sure girls do that too. So, it's that balance of, making sure that they're cared for, but also that love of sleep kind of stays with them, which is cool to see too.
Yeah, exactly.